because healthcare companies aren't consumer-focused companies. I think they're evolving in that direction, but that's not where they come from. Most life sciences companies, until very recently, the doctor was their customer and everything else was noise. And that's become much more complicated over the last 15 years with different players. But it's really the patient is kind of the last part or last stakeholder to really become a focus of life sciences companies. And the patient experience at a hospital is almost universally atrocious. So the healthcare has never been a consumer-focused kind of industry, and that is one of the things I find could be really interesting is when these real consumer-focused, consumer-driven companies start getting into healthcare. What does that mean for people's expectations about their healthcare and their health services? What does it mean for other companies that are in the space? Where is that going?
Absolutely.
They're really interesting.
Yeah, I mean, if you look at I think one of the simple examples of that is what Apple has done both with the watch, but the phone and HealthKit, and being able to make health data so much more democratized, and connecting your Fitbit step data or your Dexcom data with all these other app developers that can leverage it, and bringing that to the point of the consumer versus filtering it all through the physician has really been a groundswell in how people can engage with that data set. And informing people as much as the physician was informed before about what all that means in the context of them. So I think it's an exciting moment in healthcare.
I do. I totally agree. And I think the information that people will be able to collect on the fly is rapidly evolving. It was just with a company last week that has a watch with a different type of PPG sensor on it that has blood pressure and pulse ox and heart rate variability and cardiac output and like 6 other parameters. And it's just a watch. And I'm still not 100% sure how clinically precise all that data is, but it's getting there. And so the ability to have all of that kind of data that somebody has as opposed to just how many steps they've taken, and the ability to then layer in analysis on all of that data with enough volume to really become predictive of is, I find that really fascinating.
So I think a really good example of that is what Propeller Health is doing with their smart reminders and the risk score that they give to people with asthma. So how to use data to make it more approachable to the consumer. So rather than reminding somebody every time they're supposed to use their inhaler, they only remind somebody when they didn't use their inhaler, right? And that kind of flip on how reminders are used is kind of genius. And then secondly, their asthma risk score. So what they do is take all the environmental factors that are going on based on your geolocation, what they know about you and what your triggers are for an asthma event, and creating a daily risk score for you. So if you wake up in the morning and you're in the red, don't go out for that run because you could have a really adverse health reaction. And taking that data in the context of the person to avoid some of those really hard, expensive outcomes is smart. And I think what they're doing in the space is really remarkable.
Yeah, actually creating useful insights for somebody at a point in time where it's going to be meaningful for them.
And make it actionable.
And make it actionable, yeah.